Well, hello, everyone. Welcome back. In this episode, I am so pleased to have Doug Reynolds join us. Doug is the CEO and founder of LowCarbUSA. Before I get too far, you can find him at lowcarbusa.org. Is that correct?
That's the one, yeah.
Perfect. Doug and I have known each other for a few years now. And welcome, Doug.
Thanks, man. The pleasure's mine.
So, is it fair to ask how you, first of all, came to the world of low carb, restricted carbohydrate way of life?
Yeah, I mean, I feel like I've told the story 1,000 times, but there's always different audiences. So, really, I was a distance athlete, not an elite one, but coming in the top 100 out of a field of 15,000. So, still way behind the winner, but above average. Mm-hmm. And thought I was bulletproof, right? I used to eat pasta, and everybody, carb loading was what it was all about, right? I mean, you're a distance runner. But in my kind of mid-40s, I started to get on the scale a couple of times because I never really weighed myself much because I always thought I was bulletproof. But kind of thought, maybe we need to get a new scale or something. It's like because it's like not quite reading right. It's just a little bit high, And each year it was a little bit higher. But I was trying, I just thought I was being lazy, trying to, I wasn't running enough and getting a bit older. And so I wasn't running as much. But my knees were really sore. And as I was putting on the weight, I started to feel like a slug, which meant I was harder to run and I was hating running, literally hating running in the end. And it got to a point where I got on the scale. I was 195 pounds, which my fighting weight back in my early 30s when I was doing all these distance runs and that, I was 160. So I was like 35 pounds overweight. And I was horrified. And it was really literally within a couple of days of that happening that some guy sent me an email trying to sell me exogenous ketones. And the title was Exogenous Ketones, the alternative source of fuel to glucose. And I was hating running and struggling running, and I just got on the scale, and it just came at the right time. And I was at 51 at that stage, and I had never heard of a ketone. I did not know what a ketone was. Mm. And so I started researching it, and I buried myself for about 3 weeks. And in the end, it was a brand new company. They'd run out of stock anyway, so I couldn't order anything. But all that I'd learned was like, there's actually the diet and the lifestyle and that was just so much more effective, and I should just do that. And so I pulled the trigger, and just decided, okay, I'm doing this. And I grabbed Pam and I took her to the shop, and she was horrified. And she said even more than that, because I had a list, which was even more horrifying. And obviously we ended up shopping around the outside of the stores we all in this environment know about, going and buying ribeye steaks and full cream and full fat yogurt and all this stuff. And when I got home, the first thing because I used to cut every single little bit of fat off the meat. I used to buy the leanest meat possible and cook it, and the fat was like totally the enemy. And so now I bought these ribeye steaks that had all of this fat in like through it, Mm. And I went outside and I cooked these two things on the fire, and I brought them back inside. And it's like my most vivid memory ever was standing there with this plate with these two ribeye steaks on it, with all this fat on it. And there was fat literally slushing in the bottom of the plate. And I looked at Pam and I actually started giggling.
Hungry. Yeah.
But I started giggling.
Yes.
It's like, am I really going to eat this?
Mm-hmm.
That's how programmed I was, that fat was so bad. And I literally had to gag down the first few mouthfuls because my brain was so indoctrinated against fat. But I kept eating it, and by the time I finished that steak, or even before I'd even finished it, I started to think, you know what, this actually tastes pretty good. I'd forgotten what meat really tastes like. I'd forgotten what anything tastes like, because I'd take the fat out and it's just like cardboard. And so, you know, it started from there. There wasn't that much online back in 2015. And so there wasn't that much. And so we learned by our mistakes. But within 5 months, I was back to 160 pounds. My knees had cleared up. Within 2 weeks of starting this, I was, you know, I was doing back-to-back martial arts classes back then, twice a week. And they would finish at like 8 o'clock at night. I'd get home and crawl into bed, and the next day I would literally crawl out of bed. And I used to sit on the toilet and think to myself, man, I'm getting old. And maybe I'm lying, and maybe it was 3 weeks after I started, I was getting up and bouncing out of bed and going for a run. And the weight started coming down. Within 5 months, I was back to my 160. But all sorts of other things started happening that I didn't know about. You know, I had respiratory issues, like my sinuses were always blocked and swollen. That went away. I stopped snoring. Skin issues on my ears and stuff like that, that all cleared up. My knees completely cleared up, Even though I was running more and more and more, my knees weren't sore anymore. And I think one of the biggest things was that I had a very, very bad motor vehicle accident back when I was about 22 and had a severe TBI. And back in those days, we didn't even know what TBI was.
Traumatic brain injury?
Yeah. Yeah. So I know now what it was, but it severely affected my short-term memory. And I became very insecure because I couldn't speak in public because I would forget what I was saying, and it may even happen here. But I go completely blank. And sometimes if I'm reminded, I get it back, and sometimes I don't. It's just gone. And so it was very difficult for me to deal with that. And so speaking on, you know, in front of people and all of that was just like a no-no. And then I started doing this, and I found it didn't dawn on me for a while, but after a while, it was like, you know what? It still happens, but it's not happening nearly as frequently. And even more important than that was that I'm not as freaked out about it. In fact, I'm not freaked out about it at all. And Georgia Ede will talk a lot about that, about how it affects your emotions and your anxiety and all of those sorts of things, and how that improves, you know, once you cut all the garbage out of your life. And so, yeah, I mean, it was my birthday, 2016, January, and I was we were out at dinner. All the work people that had been with us had all left because, you know, first rule about keto is don't talk about keto, right? So, because they're all sick and tired of hearing about it, and none of them believe it anyway. But once they'd gone, it was like, we were talking about it, and you know, what was going on in Sweden with them at least acknowledging that might be an option for treating or addressing diabetes. And you had the low carb down under movement, and you had the real meal revolution and the South African movement. And like, I said, they've got a couple of little conferences here in the States, but I said to Pam, like, we need to put 1,000 people in the room. How is it that I never knew what a ketone was until I was 51 years old? It's just diabolical. And so, so we started writing to people, and you know, I thought if I can get a core of really well-known speakers, I can build on that. And Jimmy Moore was actually really, really helpful, and introduced me to a bunch of people, because I knew how to put on a conference, but I'd never been to a low carb conference, and I didn't know anybody in the space. So Jimmy introduced me to a lot of people, and most of them agreed straight off to come and talk. Gary Taubes, I wrote to, contacted him through his website, contact us on his website.
Right.
And he responded. But like was, who are you, kind of trying to feel me out. You do understand that some of us require an honorarium and that kind of stuff. And I knew about that, and I knew it was a lot of money. But he eventually asked if he could talk to me, and he sat, and I tease him often when I introduce him when he comes up on the stage. It was like I'd asked to marry his daughter, and he basically was like an inquisition, but he wanted to know if I knew what I was doing and whether or not this was going to be a real thing before he committed to it.
Sure.
And at the end of the chat, which was an hour long, and I was fully aware of what he charged for an hour of his time, he said, "Okay, if you do this, I'll come and speak." And I put the phone down and I looked at Pam. I had it on speaker, and she was standing in the passageway, just like, yeah. And I looked at her and I said, like, shit, like this is like for real.
Yes.
This is like serious. This is going to happen. That was the turning point. Established a domain, a website presence, a social media presence. None of that existed. And we put that event on at the end of July that same year, 6 months. And I didn't put 1,000 people in the room, but I put 350 people in the room, which was a lot more than any of the other conferences that had been going on at the time.
And was this San Diego?
San Diego 2016.
Yeah.
And a couple of months before that, this guy called Peter Ballestead wrote to me. He sent me a video and he said, I should be speaking at your event. And I listened to what you had to say, and I actually agreed. So you were at our inaugural event. And yeah, and I mean, you've been at numerous of our events since then, and always an amazing contribution for your perspective on everything.
Thank you. You've got one just coming up in the spring or late winter?
Well, so it's 17th, I think, of January, 17th to the 19th. I think those are the dates, but that sort of time frame in January. It was supposed to be in Boca. So like we had the virtual Boca event, virtual San Diego event, this has become the virtual Boca event. And we've booked again for the following year, and we're hoping that can at the very least be a hybrid event where we will have some live presentations and a lot of people at least joining us. I think that's always going to be a part of it now, that there will be a lot of people joining us virtually, but the people that want to have that camaraderie and that atmosphere and those relationships, and sitting at dinner, it's with Steve Finney and Gary and getting to speak to those people like real people and asking them genuine questions, and though people want that social connection. So those people will come, and the people that can't make it or can't afford it or can't get off work or whatever, then they can join us virtually.
Yeah, I think we're probably going to find that we're going to learn how to do things in a number of ways going forward, regardless of how it all works out. And hopefully that can be some good that comes out of all this. So you've been this organizing effort, presence within the low carb keto space. But you've been doing more than that. You've been, you've been facilitating and organizing some things beyond events,
just
I
guess.
Correct. Yeah. So one of the things that came out, last year, was the standard of care, which was a cooperative effort, a lot of people, but you were really a key supporter of that. What is a standard of care, and why is that important?
Well, yeah, so basically I kind of put this together. Gary Taubes wanted to have, or suggested that we have like a town hall type meeting session at the 2018 event, so that he could get some feedback from the practitioners that are actually trying to do this in practice, what their struggles are, all of that. And I think, it was going to help him with the research for his book as well. But he suggested that we get Adele Haidt, who was your very first podcast person. So to mediate this talk or this session. And so he put me in touch with her, and I asked her, would you mediate this session? And she just like, what's the right, I don't know. I was going to say vomited on me, but that's not really the right word I'm looking for. But she just like, this was this deluge of stuff that was in her brain about her vision. And it was just overwhelming. But the more I listened to it, and the more I read it, the more I started to realize is that we can actually do this. And so she actually, part of this whole thing that she sent me was a thing, and I have to put my glasses back on so I can read it here, but she was in a malpractice suit, and the judge had to explain to them what standard of care meant. And because actually very few people know. And so this is the legal definition of standard of care. It says it's defined as providing healthcare in accordance with the standards of practice among members of the same healthcare profession with similar training and experience, situated in the same or similar communities at the time that the healthcare is rendered. In other words, standard of care does not come from what is taught in professional training, from public health policy, or even from clinical care guidelines, although these can inform and help define the standard of care. Rather, standard of care comes from what a community of clinicians do in the actual provision of care. So it's like, it's a consensus. It's not a document. But her thought was that, as they mentioned in here, is that the starting point for that is a document, a clinical guidelines document to help physicians understand how to implement this as an intervention in their practice, as an option. And so we started doing this. I put together a panel of advisors of the most prominent keto people around the world, Tim Noakes and Gary Fetke and David Unwin. But basically it was just like I gave Adele her head, and she'd been waiting for an opportunity like this forever. And so she just ran with it, and she wrote the document and then bounced it off this panel and other people like Asim Malhotra in the UK and a few other people, Karen Zinn, and just continuously fed their feedback back into the document until everybody was happy that, okay, this is something that we feel is publishable. And so it was at that event that you were at, I think, the Seattle event in 2019, that we officially published that clinical guidelines document. And it's gone far and wide since then. It's been translated into 7 different languages, and I've got Malay translation in the pipeline. I've got an Indonesian translation in the pipeline. It's just, yeah, it's done amazing things, but it's not standard of care. The standard of care is all the clinicians that actually use it agreeing that this is what they do, right? And then that consensus now becomes standard of care.
Understood.
I created I knew there was a need for a professional community, a professional environment for these practitioners to exist in order to have a community and have these discussions. And so I created that concept within LowCarbUSA as well, but it just wasn't the right place for it. And it never really got any traction. And Tro Kalasian was chirping on Twitter about how we need a professional community, we need a professional organization. And I wrote to him and I said, Tro, listen, I already have that. It's just not working that well. Let's talk about how we can do this better.
Mm-hmm.
And we talked a lot, and eventually kind of came up with the idea that a non-profit organization that was specifically a professional entity for practitioners was what was really required. So I started doing that. I went and I learned how to create a non-profit organization, which is a lot harder than anybody would imagine, and started building the website and put a board of directors together, which included Tro, for that. And we are scrambling at this minute, and hopefully by the time this actually airs, it will be launched, is the Society for Metabolic Health Practitioners. And our idea is it's like an umbrella organization that everybody can come and be part of that community. Unite. There's so many splinter groups, and they have nuances and differences in what they believe is the right way for the diet to be or whatever. But we all have core fundamental values and beliefs. And so we need to unite under that so that we have a voice against the vegans and the sugar industry and the big pharma and all of those others that are influencing the dietary guidelines and the other things.
Yeah. So yeah.
Sorry, I'm so excited about this. It's hard to stop me talking. So.
That's fine. You have reason to be. The one thing I wanted to mention in that document that's posted, that was the product of Adele's guidance and everyone's input, is not just for practitioners, although it's certainly I found it immensely valuable, and the list of references,
it's astounding.
It is something that I think, certainly I know a lot of people who are researchers in other disciplines, and I think it would be valuable for them to come visit and look at the literature cited in this document, and then take that and start to internalize some of these misstatements and false messages that come against therapeutic carbohydrate reduction for weight management, for metabolic health. There's just so much information. And then of course we get the stuff about how, it'll make your hair fall out, and, you'll need to wear glasses, and well, too late for me, because both of those are happening. But, so I wanted people to understand that this is a document that certainly can be read by a broad audience, and you don't have to be a medical person, and a wide audience would benefit from reviewing it.
I agree. I mean, Adele's insistent that, she wrote it specifically for doctors by doctors, basically, but as a reference for anybody, as a guide, I think it's definitely a really good thing. So now the provider database that we had been creating over the last few years to give a place where somebody can go and search for a doctor or a dietitian that might be able to help them if they decide they want to embark on this journey. That's migrating over. The science database of all the papers and articles and everything that we had started, or that we've built there, that is going to move over. The clinical guidelines is going to migrate over so that it will have a real home now. And we're very excited about that. You'll still be able to get to all of those things through the LowCarbUSA website, but they will be home. Their home will be on the SMHP website. And the education that we're going to be providing, we actually have defined a number of different pathways that practitioners can become credentialed. So they can become accredited and actually have the right to display MHP, metabolic health practitioner, after their names, and have the badge in their profiles on the provider database and stuff, which I think is very powerful. It's not just straightforward, like do a little bit of work and it's a significant amount of effort. But so is going to university for 4 years or whatever. I mean, it's not nearly as much as that, but it requires effort so that we know and we can validate that person as being proficient in talking about this as an intervention. And it's not just for doctors, it's for anybody in the conversation. The people that have decided they want to become keto coaches. There is so much misinformation on the internet now. But keto is just like taken off, right? And so there's just a lot of rubbish out there. And so how do you know if you want some coach, if you want to go and find a coach, your doctor's told you that you need to do this so that you can reverse your diabetes. But how do you, but you want to find a coach to help you do this. How do you know that that person knows what they're talking about? They're actually telling you the truth. Now, if they can go and find a practitioner, we're still that practitioner at that stage, and they are considered proficient in being able to advise you and coach you in adopting this lifestyle and dietary choice that you've made. The proof's in the pudding. We'll see what happens when we launch it, but I am very optimistic that this is going to be something special. And we have and Adele now is part of the steering committee, which oversees all the other committees. And we're starting to create committees. The first one is the clinicians committee, which is responsible for maintaining and updating this clinical guidelines document and building on it and providing addenda for condition-specific issues and stuff, so like for cancer and even diabetes, any of these things often have little nuances and things that where some things work better for people in this group than they do in other groups. So we want to expand the guidelines to from the generic one that it is right now to cover all of those nuances if we can. So that's the first committee. The education committee is involved in we've got a lot of education in terms of teaching the converted enough to that we can give them accreditation. But what this committee made me very aware of was that what we don't have is education for the non-believer, education for the skeptic, education for the, lack of a better word, ignorant, right? The person who hasn't heard about it. A lot of people, even doctors, have heard about keto now because most people have, but they still don't understand that it's potentially a very valuable intervention that they should be including in their practice as an option. So now the guys are starting to create, it even came up at our event, the virtual event in San Diego, like you need a one-pager to be able to hand to a doctor for somebody to be able to print out and take to their doctor or whatever that will trigger that urge to actually go and learn some more about it and hopefully at that point then understand that, wow, this is actually something I should have been considering a long time ago. So now we've got an outreach committee that's going to be something we've become very aware of, is that a lot of people believe that it's only for the rich people, or only for the middle class, and that the poorer people can't afford to eat this way, and that is absolutely not true. But somebody has to teach these communities that that's not true, and to have groups and pilot groups, and like they do the Eat Better South Africa program. Yes. Have like they go into community and basically take over a whole little village, and then provide them with support and food and medical support and food and everything, and teach them how they can eat for the same price, if not even less, and yet become metabolically healthy. And that serves as a pilot study, which then you can expand to the larger communities and stuff. So we've got a committee doing that. We've got a committee looking at trying to get through to the insurance companies about trying to get them to mandate that, or to incentivize
support, or
incentive. Yeah, and the first insurance company that actually genuinely takes this on is going to kill it. You look at life insurance companies that start giving people incentives to come back with better numbers and stuff, you know, that shows that they are adopting
meaningful numbers, not the standard.
No, not the numbers that they've all been taught, but really, yes, exactly. So you find them, teach them what they need to be looking for, have all these programs, maybe develop training and education that they can provide to their to the people that are taking insurance from them, and saying, look, if you do this, first of all, you're going to be so much healthier, you're going to be so much happier, and you're going to pay half the premiums or whatever, because you're not going to get sick nearly as often, and you're not going to die nearly as soon. So yeah, and the actuaries that actually work that out first are going to absolutely kill it.
So there's lots of, I mentioned before about tipping point. I'm very interested in what can be done to, as you say, reach the audiences that haven't heard yet. So a phrase that you've used, and I'm used to using it, but I'm not sure a lot of people are aware of, is, and I know people get crazy, but diabetes reversal. Now we're talking about type 2 diabetes. And I've heard other people use a phrase, drug-free remission, to describe what I think is the same thing.
Right.
So how, clearly that's one of the most well documented roles of therapeutic carbohydrate reduction that we have from the literature.
Absolutely. I was going to say, as you were talking, I had something I was going to say. What
tipping point? No, but so I guess that this idea that type 2 diabetes is not progressible, a chronic, progressive, incurable.
Okay, yeah. So sorry, I was thinking of something to say about that, but now, what are you asking about? Are you asking about the tipping point in terms of when do you think what?
Well,
because I've got a lot to say about diabetes reversal. So
yeah. So I think this is right. We've got something approaching 50% of adult Americans are diabetic, pre-diabetic.
Yeah.
So reaching the already diabetic type 2 or the pre-diabetic population with a message of a drug-free remission is possible for you would seem to be a way to really accelerate this.
I agree. And I think that's one of the mandates for this education committee is to come up with, I talked about education to teach the skeptic in terms of the doctors and that haven't taken it on board yet. But then the same thing. I mean, you know, if we can convert a patient and they put themselves into remission and then they go to their doctor, and I mean, that's how Dr. David Unwin basically came to know about keto and carbohydrate reduction. Because one of his patients went off and did it herself. And she came back to see him and he didn't recognize her. And he said, you know, you must be early or something because I'm waiting for another patient. She said, nah, it's me. And he said, well, what are you doing? And that's how and then he started thinking, okay, so I need to go and learn about this. But he had the courage, like Brian Lenskes and all these doctors, the ones that actually question it and say, you know what I've been doing all these years hasn't been working, and look at this is working. So why? Try and learn about why. And I often tease most of them that they should have been engineers and not doctors, because it's those ones with those inquisitive minds that stop and say, wait a minute, we need to look at this. Diabetes reversal, that's a minefield, but people won't accept. They say that it's remission, people won't accept that it's like brain cancer or cancer can go into remission. There's always a chance without changing anything else that it will come back again, right? That to me is remission.
Okay.
They say, oh, but if you start eating carbs again, your diabetes will come back. It's like, well, shit, if you found out that you were always sick and you found out that there was some traces of arsenic in your water, and you took that out of the water and now you're better, if you start drinking the water with arsenic again, you're going to get sick. But you are cured of that whatever illness you had because you were being poisoned. And I see it the same way. It's like, I've heard, I think Jason Fung even uses the term cured quite often, and he gets yelled at about it. But he says, like,
well, if you're allergic,
they've stopped eating, they've stopped taking the poison, and so now they're cured. If you want to take the poison again and get sick again, that's up to you.
If you're allergic to strawberries and don't trigger the allergy by eating strawberries, what do you call it?
Exactly.
But if you eat the strawberries, well, then it's there. So we've spoken about all that you've seen in your organizing and these really important things that are coming. The metabolic health practitioners is got to be critical to this, the certification, and then the assurance from the public. The issue of making it mainstream, right? So I remember when you used to be able to travel, and I would travel a lot, and I'd be on back roads, and maybe I have to stop by the truck stop or the Dollar General store, not to but small markets that serve these kinds of communities, and you can get what you need at those places if you know what you're looking for and what not to buy. And so one of the things I've been grateful to you for is your resistance against the complicating messages of it's got to be this, that, or the other thing. If you've got anything to say along that line, I'd appreciate it.
Yeah, well, I was super excited to hear that you talked about it, and you brought it up a bit with Adele as well, because you spoke about this at that talk in 2016, and I heard you did a really good podcast. I think even at that event with Ivor Cummins, where you delve into it as well, and that was the difference between grass-fed and grain-finished beef. Just go with beef. And that you showed that, yes, there is a little bit of a difference between, and the ratios maybe between omega-3s and omega-6s, if you take just that, is more than it should be. But the absolute amounts in there are kind of negligible. And so whether it's grain-finished or grass-fed or whatever, the effect on your health is, from what I can tell, is like non-existent. And I tell people that we can't afford grass-fed beef. We don't eat it. We go to Stater Brothers and Albertsons, whatever, the grocery stores, find where they've got all the specials on, and we buy the manager's specials. And I'll go to Stater Brothers and they'll have ribeye steaks or something on at $3.99 a pound. So basically there's a couple of days until they expire or something, right? Or even more often what happens is that they're not cut evenly. So
yes.
Right. I think that's actually more often So it's like the last one is like a wedge. Sometimes a bad wedge, but quite often it's a wedge, but it's not that bad. But so now it's not even thickness all the way through, so it won't cook through evenly or whatever, blah, blah, blah. So it's now in the manager specials at $3.99 instead of $21.99 a pound next door here in the display case, right? So I'll go and I'll take the whole bunch of trays and put them in my trolley. And you keep looking for stuff like that. And, you know, I mean, tri-tips. I've got a video on our YouTube channel, dude, like how to cook an awesome medium rare tri-tip. And, you know, I found a tri-tip the other day for $2.99 a pound. Huge, like 4 pound, 3 and 3.8 pound tri-tip. You know, that lasted Pam and I like two meals, but that, you know, for I don't know, what was less than $10. Yeah, it was like for two of us, 2 meals each. That's 4 meals for $10, like full on meat meal, you know. And that's, to me, I'm sorry, but $2.50 is pretty reasonable. I think most people who battling can afford that. And if they can't, they make that last longer and maybe supplement it with some other cheaper vegetables or whatever that they can in order to get enough to eat. There's yes, exactly, eggs. I mean, you can buy eggs for a couple of bucks for a dozen, right? Yeah. There's just so many things that people can do if they don't have the money to buy all the expensive cuts and stuff. And that's what I am, and I get up on the stage whenever you talk. It's like, okay, I'm waiting for you to say this bit about the grass-fed thing, and you're talking about some other subject and you don't say it. So I get up, and before the Q&A starts, I just need to tell you something. and I bring up the fact that you had taught me this a few years before, and that please don't ever tell me that you can't do keto or you can't do low carb or restrict carbohydrates or whatever you want to call it, because you can't afford grass-fed beef. Yeah, absolutely don't let me hear you telling someone else that they can't do it.
Yeah. Right? My moment of awakening, one of them, was a gentleman I think a lot of, really excellent grazer. I've known him for decades, literally decades, and he said from the audience after one of my presentations to an agricultural group, well, if you're not going to have people eat an all organic diet, then you should just leave them on the standard American garbage diet. And in that moment, I realized, okay, belief system versus objective evidence, right? I can't currently break into his worldview. But clearly we're not operating on evidence, and talking to some of the pioneers, the longtime practitioners in this field that we're talking about, none of them had these label claim foods available to them. They didn't exist in the marketplace, and yet people got well. So what, you know, could they have gotten weller with it? Well, maybe, but do we have the evidence to support that? And I haven't been convinced by what I've looked at. And I'm also impressed by Liebig's barrel analogy, the law of the minimum. You know, whatever is that short stave is going to influence everything else that you're imagining, unless you correct for it, and now you can look at whatever becomes limiting next. And so telling somebody they have to spend more than they can afford in order to do this, and if they did that, that creates stress. Well, that's not good for a human being. All these sorts of things. So and then I understand that there are other arguments, and hopefully as this enterprise goes forward, I can bring those voices. Instead of being the pipe for what they taught me, I can have them come and give that information directly. And in all these ways, just bring together from production all the way through to the health of the consumer and the society that that consumer is a part of. Just the critical nature of us addressing this epidemic of metabolic disease. So I'm so grateful for what you've been doing, because it has to be done. I'm still fascinated by the idea of how do we get this out to some of these, you know, more remote areas.
Right.
And
so maybe that's something that we need to do, Peter, is put you on that education committee, because that's their mandate, is to come up with strategies and ways and content eventually to do exactly that, to reach the people that aren't being reached, that are difficult to reach. And so if you know, maybe you have some ideas, or they at least be able to sounding board, like they come up with ideas and say, nah, that won't work with that community or whatever. But that we need to have these discussions and come up with the content.
Absolutely. I am always willing to help. I have a number of things that I'm already engaged in, including an international conference that's coming up in 2023, the title of which is Grasslands for Soil, Animal, and Human Health.
Okay, cool.
And so what I hope to be doing is finding people to fill that human health component, so that when all of these people hopefully come from around the world to Northern Kentucky for this event, that they can be given information that they can take back with them to help the development of their resources and their livestock enterprises, and improve the health of their populations as well. And so I'm always willing to help, and thank you. I really think that when one of my ideas is, okay, to a certain extent, we're talking about, you know, high income countries, right? North America, Western Europe, fine. This metabolic disease epidemic extends across low, middle, and high income countries.
Totally, there's no boundaries.
Yeah. And so you mentioned Eat Better South Africa,
right,
as one model of addressing needs within that population. I'm sure there are others. Forgive me if I'm not remembering this correctly. Did you go to Southeast Asia with a conference, or am I?
We went to Jakarta. Yeah.
Okay.
In fact, it's the guy that got us out there. He contacted me and said, like, he's also an engineer like me, you know, and he goes around Indonesia basically teaching small groups of doctors about low carb and converting them. He's got like about 600 doctors or something now in his community, all on his own. But he wanted to do like a bigger conference type thing. And so he reached out to me and asked if I would help. And I took three of our top speakers, really, that I've had at other events with me. And we went and helped them put on this event. And it was, it was the most, not the most, but probably one of the most, what's the right word? I can't even think of the right word. Just like meaningful experiences. The people were just astoundingly nice and welcoming and accepting and needy, and to the extent that, you know, he's got to a point where he's actually going and having meetings at the presidential palace. The president's aide actually attended the meeting, and they had set up a kitchen at the back where the speakers and the organizers and that sat and ate during lunch. And we were sitting there, and this guy came and sat, and you know, he's like pointing a finger at me and saying, like, we need to come up with strategies about how we can educate our people about this, because, and especially in Indonesia, they are a net importer of rice, right? So as much as rice is their like a major crop, they don't grow it. They just don't have enough space. And there's so many people on all these thousands of islands that they've got that they have to import rice almost entirely. And it's costing the country an enormous amount of money. And if they can reduce that, apart from the health costs, because most of those people are impoverished, and so they, you know, if they end up in hospital or whatever, no one's paying for it except the state. And so they're going to reduce those costs. They're going to reduce their rice import costs, and he recognizes that how important this is, and he's taking it to the president of Jakarta, and reporting to him, and being tasked with liaising with Tio and coming up with these ideas. So one of the things is, I mentioned in Indonesian translation, those clinical guidelines. Tio has got some of the doctors in his community to actually start a translation into Indonesian, which is the main language. Apparently there's like hundreds, if not thousands, of languages. So, but most of them speak at least, you know, the generic one, or the common one, which is Indonesian. So same as Malay in Malaysia. Yeah. So we're getting those two translations done.
So this all from you deciding that there needed to be, you were going to put 1,000 people in a room. I mean, that was what year?
That was the beginning of 2016 when I made that statement. Yeah.
And then this was 2019 that this happened, right? That you were just talking about.
Correct. Yeah. So
that's 3 years from there to here, and now we've talked about everything else that's going on. So the encouragement to people who want to get involved, you know, kind of one of my, grow where you're planted, right? You don't have to be somebody else, be you, where you are. And there's lots of people that will come alongside, will, get in front and pull on the traces, or get behind you and, whatever. But we can do this. And you mentioned the practitioner locator. That's probably not the phrase you used. And you said it was migrating.
Yes. So we created a provider list where anybody can go there and put their contact information in there, the speciality. But it was very Spartan, right? And we talked earlier about starting simple. If I tried to put all the bells and whistles in place at the time, I couldn't afford to pay someone to do that anyway. So, we built this. If you were in the US, you could only search on zip code, and any other country you had to search on city. And I think we got about almost 800 practitioners basically put their information in up till now. But now, with this new thing, this is all migrating over, and now we've got this whole fancy, and if somebody wanted to change something, they had to send me an email, and I would go in and change their email address or their photo or whatever it was. Now they're going to have a profile where they can describe what they're doing, change their pictures, like be really creative about how they present themselves. There's a place to upload all the certificates of all the training you've done, a place to come in and apply for accreditation once you've met all the criteria for a for a particular pathway that you may be trying to follow. And it's giving people and you could search on zip code, city, state, country, speciality, doctor's name, all of these different ways that you're going to be able to search the database. and now that you know, when we launch this, I know that there's huge people with huge followings like Tro and Canberry and or Georgia and all of these people who are going to say, hey guys, you need to come and take a look at this, which nobody was saying about. You need to come and look at the professional environment that Doug's created on LowCarbUSA, right? Yeah. But now everybody's, they kind of taking ownership of this. This is like our thing now. And now they want to, Tro can't wait to start to start telling people about this, you know? And so I believe that list by the end of the year is going to, I don't even, maybe tenfold, I would imagine, and keep growing at an enormous rate. And that's so,
wow.
Then it becomes more and more useful to people anywhere in the world to be able to find, you know, a practitioner. And especially with COVID now, there's a lot of the laws requiring someone to be licensed in a particular state or whatever is kind of being relaxed. And so doctors are finding, in some states anyway, that they're able to do online consults with people that aren't in the same state as them. And so even if you can't find a practitioner or a doctor or a dietitian or whatever you're looking for near enough for you to go and visit, you should be able to find someone online that will at least be able to talk to you and advise you. And please do that rather than let your doctor tell you that you're going to kill yourself and you need to stop doing this. That just like kills me. It really does.
So two last questions. We're coming up on the time that I promised you. And one is most of the content from your conferences that LowCarbUSA has produced have been videotaped. And so are those available free? Where do people go?
So normally they were behind a paywall for the longest time. You know, we needed to collect money wherever we could, and you know, paying the IT guys and that to do those recordings was massively expensive. But then Dorian Greeno and Gemma Kochis, who basically founded and run Keto Mojo, came and offered me a solution for that. And basically, so they license the videos from me, and then they put them on the Keto Mojo site, freely available to them. And so they pay me a license fee to be able to do that. So basically, so for the first 4 months after the event, people can still come and sign up and register and watch it. And then that still qualifies them for their CMEs and that kind of stuff. But then after 4 months, the videos all become, he gave me a number the other day. It's an astounding number of videos that they have already on, so go to ketomojo.com. I think it's keto-mojo.com. You search for Keto Mojo, I'm sure you'll find it. Look for the videos, and there's a whole series on LowCarbUSA conferences or whatever.
Perfect.
And all your talks are there, a massive amount of information.
Wonderful. What does Doug like to eat? What's your diet food?
So when we first started doing this, and I think it's like most people are they think like, I'm not eating carbs now, so I'm missing out on something. So I need to make sure I get my nutrition in. And so we were like fully into all the green vegetables and stuff, the spinach and kale and broccoli and cauliflower. Though that's not really green, but it kind of qualifies in that set. And I was eating more vegetables and stuff than I'd ever eaten in my life, and kind of proud of it. But in those days, the carnivore movement was still in its infancy. And we even had a couple of speakers talking about oxalates and some of the different things and different vegetables, and Georgia E. talking about, you know, what beef is a superfood and plants are trying to kill you or something. And so I started to become aware of the fact that maybe we didn't have to have as many plants as we thought. And then you start to learn, and you actually start studying the science, and you learn that not only are all the required nutrients available in spades in animal products, but they're also totally bioavailable, whereas most of the ones that are in vegetation, as I've started to call it, are not. And there's actually, apparently someone explained it to me that it was like they try to stop animals from eating them, so they excrete these toxins and stuff like that that make the stuff taste bitter and all of that kind of stuff. And I don't know, but there's apparently a lot of ways that plants make themselves undesirable, supposedly. So we just cook the hell out of them and add sugar and bunches of spices and stuff like that and make them taste palatable and insist that we have to eat them. And so, yeah, a ribeye steak is always going to do it for me. But we eat a lot of stuff. We had some fish last night. We eat quite a lot of salmon. Haven't done for a while, but we've got cans of sardines that make a really good thing. There's a dried meat product called biltong, which hails from South Africa. That is just, I think you've tried some. That is to die for. And I make my own. So I've always got tons of that in the fridge. And a couple of ounces of that, since it's dehydrated, is actually, 3 ounces of that it's like 6 ounces of steak. It's normally pretty fatty. So I sometimes just have a few ounces of that as dinner, But yeah, avocados, I'm afraid, should be classified as an animal product. Because, yeah, I really love avocados.
Somebody called them alligator pears. I'm not sure. Maybe that'll do.
Yeah, there we go. So yeah, I think people need to find what works for them, and I've had many discussions on my podcast and stuff about, I even did a big thing with Rob Sivas about, can you do keto on a vegan diet? And it's difficult, and you need a lot of supplementation, but you need a lot of supplementation to do any kind of vegan diet. And but if that's what you want, if that's your religious beliefs or ethical beliefs or whatever it is, and there's no other way you prepare to eat, then yes, there's still a way to ensure better metabolic health by reducing carbs, increasing the fat, the healthy fats, and just changing the structure of your diet. And I think that's what we try to do. LowCarbUSA, we went through a lot of iterations before we settled on that name. And I think the main reason I wanted to choose that name was so that we didn't alienate anybody. I don't want to ever alienate anybody from the conversation. I don't care if you're vegan or carnivore or somewhere in the spectrum in between. Some of us evolve. In fact, I think a lot of us start out somewhere in what we believe is right or what we think is right or whatever. And then over time, as we learn more and our tastes change, which they do as you change what you eat, you evolve. And so, and Pam and I have evolved like that as well. And so we're not carnivores. Yeah, but we don't eat much vegetation.
Yeah, well, and I surely hope we can disagree without being disagreeable, and I surely know my own limitations at times in front of certain circumstances have led me astray. But what I hope we can do is we can present evidence to the best of our knowledge, honestly. And and make sure people understand what is a meaningful metric of health. You know, it's not total cholesterol. It's not LDL cholesterol. It's not BMI. Well, we've just taken care of 3 things that most people are talked to when they go to the, okay. So how do
everybody.
how do we, so, and then what is, Adele Hike gave me this, and I heard somebody say, if you hear something you like, the first 3 times you repeat it, you give them credit. After that, it's yours. I'm well past 3 at this time. Her comment, her teaching me was to focus on essential, adequate nutrition. That's what we're trying to do. And number 2 would be maintaining or restoring metabolic health. And if we should all be able to agree on those 2 goals, and then how you do that. Now, I understand you have to have significant conversation underneath each one of those, because there's a lot of misunderstanding. But in concept, we should all be able to agree on that. And then move on down, and it's all up to individuals, their experience, their desires, their preferences, because there's no one size fits all, right? I mean,
no, totally. And Adele's so good at
oh yeah,
about what's the right word? I can't think of the word I'm thinking of, but she just describes it so well, and she's so passionate about making sure that people, and that's why she wants to be so involved in this organization, is so right from the start, it starts out with the kind of the proviso that no 2 people are the same, and that they should not be ever treated the same, and that everybody needs to find what's right for them, and then just make sure that they get proper guidance in terms of the different things that they try as to what is might work for them or not, but which things are going to really
how to know
or influence their health badly. If it's going to have detrimental effects, then they need to know not to try that. But if something is, just because something doesn't work doesn't mean it's bad for you. It just means it doesn't work or it's bad. But there are some things that are like really bad, but some things are bad for some people, and they don't work, or they cause, you know, I would almost say it's like, what is it? Man, I can't remember the word, basically. Allergies. You have to look up to the left. Allergies. It's almost like an allergy, right? So some people, the funniest thing was, I don't know, you know Georgia Eid? Right. So she went carnivore as an elimination diet, because she had so many issues that she was never, even when she went keto, a lot of them improved, but some stayed or got better but didn't go away. So she went completely carnivore, and they all went away. And her idea was she was going to add that stuff back until she worked out what, and she's not. But what she also worked out was that beef doesn't work for her either. She's got some kind of allergy or bad reaction to beef. And so she's eliminated that from her stuff. So now she eats poultry. She eats a lot of duck, because that's got all that fat on the breasts and stuff. They've got this, like, they're on on order basically weekly. She gets this delivery of duck breasts, and you know, but then fish and all the other meat, animal products that she can still eat. That's not beef. And she, I don't know, I saw her a little while back in person, and she is just looking fabulous. Like, it's
excellent.
She's just, it's like a different person, how healthy she looks.
I miss the people that I used to routinely get to see. So it'll be interesting when we get together again, whenever that good and happy time is. And just to wrap it up, you had said you were talking about the goal, and I wanted to say thank you so much for all that you're doing to enable and facilitate or support that becoming reality for more and more people. And urge people to look you up on LowCarbUSA.org
and metabolic metabolic practitioners.
Is it
metabolicpractitioners.org will be the new SMHP site. And by the time this, the developers are having some big problems with the database right now. There's a bug in it that they can't find, but it will be in a few days, hopefully by the end of the week, even available. So by the time this airs, it would be there. So metabolicpractitioners.org.
Perfect.
And LowCarbUSA.org. Those are the two places. Yeah.
Thank you so much. Thank you for your time.
No, pleasure, man. This was awesome.
Excellent. I wish you good health.
Sorry I talked so much, but I'm kind of excited at the moment.
Good. You have reason to be, and not at all. It's a pleasure, and I look forward to the next time we can sit down and share a couple good ribeyes.
Yeah, for sure.
All right, friend.
Cheers, man.
Take care.
Okay, bye.